Alright, so today what I want to do is talk with you about your diagnosis, which is binge eating disorder. What this means is that you consume an unusually large amount of food in a short period of time, and you feel like you're out of control and you can't stop. And by a short period of time, typically is 2 hours or less, and large amounts of food would usually consist of like about 5,000 calories, sometimes even 15,000. Now, it is common for a lot of people to overeat on occasions, such as holidays like Thanksgiving, Christmas, but the difference with binge eating disorder is it becomes a regular thing. Uh, by regular thing, it would need to occur like at least once a week for 3 months to be considered binge eating disorder. Some people with binge eating, they may feel embarrassed about the amounts of food they're eating. So they'll opt to do it in private because they don't want people to see how much food they're eating. Most of the people who have binge eating disorder, they're obese, overweight. Some are a normal weight, so just because someone's a normal weight doesn't mean they're not suffering from binge eating disorder. One thing that kind of some people confuse is binge eating disorder sounds like bulimia to an extent. But the difference is with binge eating disorder, there's no compensatory behavior. So with bulimia, someone might eat large amounts of foods and they're going to follow up with the compensatory behavior of, for instance, vomiting, use of laxative, or exercising excessively to rid their body of the calories. Fortunately, there are other side effects that could impact your health if the binge eating disorder is not treated. And that could include like joint muscle pain, because if you're overweight, gallbladder disease, diabetes could cause depression, anxiety, high blood pressure. You could even experience cardiovascular disease. Now, what's the recommended treatment for binge eating disorders? Therapy, which is what we'll be doing. And I like to use the cognitive behavioral therapy, but people can also be treated with interpersonal psychotherapy or dialectical behavioral therapy. But it's recommended to work alongside with a nutritionist and a psychiatrist. That's because we want to make sure you're getting the appropriate amounts of foods, and psychiatrists if you need any kind of medication prescription. So the etiology of the disorder I'm going to read to you, and it comes from ncbi.nlm.nig.gov. So, according to them, binge eating disorder is a complex behavioral phenomenon that resembles substance abuse and addiction in its etiology and biology. Researchers have found that alterations within the dopamine and endogenous opioid system have been identified in individuals with binge eating disorder. For example, naloxone decreased the intake of palatable foods in individuals fitting the criteria for binge eating disorder, but did not alter the food intake in non-binge eating, obese, or normal weight individuals. Opioid receptor binding within the insular cortex in individuals with binge eating disorder is decreased compared to people with no symptoms of disorder. Disparities in the dopamine receptor and the dopamine transporter gene expression have been linked to binge eating behavior in humans. People with binge eating disorder are more sensitive to appetite-suppressing effects of the central nervous system stimulant methylphenidate. This indicates there is an alteration within the dopaminergic reward pathway in these individuals, but the exact nature is not known. So basically what this means is the data suggests there may be differences in the opioid and dopaminergic signaling pathways of healthy individuals compared to those with disordered eating. Now, aside from biological factors, which is what I just went over, there are other things that can play a role in binge eating disorder. For instance, it could be psychological, like you might have unhealthy coping skills if you're dealing with your emotions. For instance, you're angry, you're upset. Instead of like some people might do, which would be healthy coping mechanisms, like ride a bike or listen to music. Individuals with unhealthy coping skills may use overeating to deal with it. Body dissatisfaction can also play a role in someone developing binge eating disorder, or even depression. And then social culture can play a role in that experience. People who have had a history of sexual abuse, or kind of some social pressures, like you may hear critical comments from family members or friends, and family history is also known to be a contributing factor, but more research is needed to determine the exact causes of it. And everyone's different, so what may be causing it in one person's not necessarily going to be a cause of it in another person. So the medication that we're going to talk about, which is the first and only FDA-approved medication to treat binge disorder, is called less-defexatinine, and that's the generic name. The brand name is Vyvanse. I'm going to refer to it as Vyvanse because the generic name is kind of difficult to pronounce and it's longer. There are other off-label uses, off-label medication uses to treat binge eating disorder. This could include like antidepressants or even Topamax. Vyvanse may sound familiar to you in that it's been used to treat ADHD medication. It's been used to treat ADHD, but it is, again, the first and only approved medication to treat binge disorder. So the class of medication that Vyvanse belongs to is the central nervous system stimulant. Comes in a capsule form, so it is time released. And in case you're not aware of the central nervous system, it does consist of the brain and spinal cord. So the mechanism of action for Vyvanse, which is how it works, that kind of involves like the chemicals, it increases the flow of the neurotransmitters dopamine and norepinephrine. So for people being treated with ADHD, this increases the person's ability to focus. But if you have binge eating disorder, it's going to help reduce the urge to eat and kind of the obsessive feelings you may have with the urge to eat. And you can expect it to work within the first 2 hours. And this will be the first time you take the medication. So typically you're going to start off with 30 milligrams, and after the first 2 weeks, you may not experience like the same results. That may not be helping you as much. So at that point, your psychiatrist will probably increase it to 50 milligrams. Sometimes it's 70, but the max dose you could ever take is 70. And again, it can take, the first time you take it, which would be the 30 milligrams typically, 2 hours to take effect, and it can last up to 14 hours in your system. So you do not want to take the medication later in the day, still be in your system, and it could cause sleep problems at night. There are reasonable side effects you can expect from the medication, which wouldn't cause too much alarm. Some people find that they experience dry mouth, can kind of deal with that by chewing gum or increasing the amount of water you drink. Decreased appetite, so with that you would need to monitor your food intake, but not to the point where you're obsessive, because we certainly don't want to create obsessive behaviors with calorie counting, things like that. It could cause dizziness and irritability. The irritability could be okay as long as you're not like lashing out at people or throwing things or breaking things. But there are some symptoms that if you experience them, please call the doctor. That could be like colors, like changes in your fingernails, fingers and toes, like color changes in your fingernails and your toenails, difficulty breathing, chest pain, or if you have another mental health problem, it could be worsening of that. So please call your doctor if you're experiencing them. You don't want to mix Vyvanse with alcohol or street drugs like with any medication. This could result in cardiac arrest or death. And ask your doctor, like with any medication, if you're taking, before taking over-the-counter medications as well, just because you want to know that those aren't going to interfere with the effects of Vyvanse, and Vyvanse isn't going to interfere with the effects of those medications. If you're taking an MAOI inhibitor, don't take Vyvanse, and you want to be off that for the MAOI inhibitor for 2 weeks. And I have a list of some types of medications that Vyvanse may not react well with, and that would be like if you're taking a urinary acidifying agent, androgeneric blockers, antidepressants, MAOI inhibitors, and I'll go over that with you because that could slow the amphetamine metabolism process. Antihistamines, because the the Vyvanse may kind of counteract the sedative effect with the antihistamine. Antihypertensives, chlorpromazine, 9-ethosuximide, haloperidol, lithium carbonate, meperidine, methamphetamine therapy, norepinephrine, phenobarbital, phenphotoin, profaxine, and veratrum alkaloids. And this would be something, if you are taking those, your psychiatrist would need to be aware of. Now, blood testing, I know with some medications, they do require blood tests. Vyvanse blood tests are typically not required unless you have a pre-existing medical condition. For example, you may need to have like your liver checked if you do have issues with your liver, just because that's how medication is processed. So you want to make sure that's okay if you have pre-existing conditions. Blood pressure, they would need to check if you already have a pre-existing history of high blood pressure. They would need to monitor that because Vyvanse can increase your blood pressure. And caution is needed for people who have bipolar disorder because the stimulant can trigger psychosis. So even if some people may not even have diagnosed bipolar disorder, so they take the Vyvanse, this could bring it out. So again, that's why it's always important to really be in contact and communicate well with your prescriber. And there are risks when you discontinue the Vyvanse, and that's because the decrease causes kind of a sudden decrease in the number of neurotransmitters in the brain, and decreasing the number of neurotransmitters in the brain suddenly like that, that can cause the withdrawal symptoms because the body, it has to adjust to this. And withdrawal symptoms, which can be unpleasant, headache, you may have an increase in appetite because you're no longer on the medication, lead to depression, hypersomnia. That would be oversleeping. Irritability. With this irritability, it could also include lashing out, yelling. You may experience fatigue, suicidal ideations, which that would be kind of experiencing suicidal thoughts. That could also be a withdrawal symptom. So to avoid the withdrawal symptoms, you would want to gradually work with your prescriber to taper down the medication. That could, just so you don't have kind of the sudden stop. So you might be taking, like if you're taking 50 milligrams, you kind of started with 30 milligrams, your prescriber may decide to put you back to the 30 milligrams for a little while and then completely stop. Like with any medication, you can experience also, unfortunately, an overdose. That's why you do not want to take more than the doctor has prescribed to you. Also, please, with this medication, any medication, it does have some street value to it, and there's again the risk of overdose. Make sure you do not keep it in an area that anyone can have access to. For instance, you have kids or guests or roommates, you don't want people to take the medication. They could end up selling it, or they could have an overdose. So the signs and symptoms of an overdose with Vyvanse could include like kind of uncontrollable shaking, like you might even look like you're convulsing, very, very rapid heartbeat, hallucinating, like you're seeing or hearing things that aren't there, feeling panicked, like, oh, what's going on, I don't know where I am, aggression, confusion, like along with the panic, like where am I, you may like lose your thoughts, you could have like nausea, vomiting, weakness, and unfortunately you could have seizure, coma, cardiac arrest, and death is even possible. Again, this is why when you're on this medication, any medication, you need to work with your doctor. It's really by doctor I mean your medical prescriber, which could be a physician's assistant or a nurse practitioner. And then you'd also want to work with me, your therapist, and your nutritionist. But researchers have shown positive results with Vyvanse, especially if it's combined with the therapy and the nutritionist. So I'm going to go ahead and refer you to your prescriber, and he or she will determine from there if the medication is appropriate for you. And from that point, we'll kind of go from there with treatment.